Hi, this is Dr. JD Hasenbank. I'm going to show you how we evaluate shoes this morning. When we take a look at shoes, there's three components we want in shoes. Number one, we want forefoot mobility. So where your foot moves in the front, we want to have mobility there. We also want to have midfoot stability because your arch doesn't really move much, especially when you come up on your toes to push off. That arch should be solid. So we test midfoot stability, and then rear foot, we look at canter. Okay, a lot of times it's hard to actually see if it canters in or canters out, depending on what you need upstream. The best way to test is to actually do a stretch test, and we'll go over that in just a second. But if you can grab one of your shoes, we'll test forefoot stability first. Your toes move right around here. If you take your foot and you actually move it, you actually see where most of the movement actually occurs in your foot. Okay, it occurs right along the balls of the feet, and that's where you want your mobility to occur. If you don't have mobility in the forefoot, you have to use a lot of extra tension in your calf and in your Achilles tendon. Guess what? You start to get Achilles tendonitis as a result. Okay, so forefoot stability, or I'm sorry, forefoot mobility. We want that thing to move in a nice, easy fashion. If you pick up a pair of shoes and it's just real stiff and rigid, or your own shoes and you're checking them, it doesn't move very easily, then all of a sudden you're having to use more work to roll off that forefoot and push off. Okay. Now also when we're in this position right here, we want the midfoot, which is the arch area, to be stable when we're pushing off. We don't want it to fold or give in this area. Now, your shoes actually take anywhere between 3 and 5 times your body weight when you're running, so this needs to be really stable. This isn't stable, all of a sudden your plantar fascia and your deep foot muscles are having to overwork, so it overstrains and stresses them when you go to push off. Okay, so let's review that again. Forefoot mobility, midfoot stability, which is where you grab the front and the back of this arch and you fold it. Let me show you one that doesn't have midfoot stability. Okay, used to. Okay, this one has forefoot mobility, but as this one broke down right here in this area, look at what happened to the midfoot stability. Crunch. Okay, nothing there. So as we go to push off, that arch collapses and falls. Not good as far as when we're talking about overuse injuries. Creates a lot of tension in the plantar fascia, works the muscles really hard upstream in the knees and the hips and low back. Okay, this is the same exact shoe that's brand new. Forefoot mobility, midfoot stability. So I don't even watch anymore for wear pattern on my shoe. I watch to see when this thing breaks down, then all of a sudden they're history. They're not running shoes anymore. Okay. So how do we test for a rear foot canter like this? Or what do we need for our own feet? We'll go over that in another video, but the easiest way to do something for right now is take your shoes off, stand up, stretch your hamstrings out, see how your calves and hamstrings and low back feel tension-wise, see how far you can go. Okay, then put on a pair of shoes. If it has forefoot mobility and midfoot stability, it passes the first two tests. Okay, then you stick on that pair of shoes and you stretch over and you see if it actually, if you feel the same in those shoes, you feel tighter or you feel looser. Okay, the goal of getting the right shoes is to actually feel looser, more limber. We'll shoot another video to show you how to do this in a little more detail, but that's a quick bullet on something you can do. Throw on the shoes, and if it loosens you up, those are the shoes you want. That's going to be the exact pair that you're going to want to put on and go running, because you want your muscles to be looser. You want to work less hard, be more efficient when you're out there running. So stick on your pair of shoes. If they loosen you up, then that's great. But they have to pass forefoot mobility, midfoot stability test, and then the third one is stick them on, stretch over, see how they make you feel. If they make you feel looser, great, that's wonderful. If you still feel about the same or you feel tighter, no go. Okay, you got to keep looking. But we'll go over more of medial and lateral canter on shoes and how to actually fit that for yourself and figure out which ones you are.